But one thing I do want to share with you is I pulled a study. I like looking at studies because that's just what dietitians do. So this is clinical course and risk factors for mortality of adult inpatients with COVID-19 in Wuhan, China, a retrospective cohort study. And this looked at, I think it was 191 patients that came in that all tested positive for COVID. There were 137 survivors and 54 survivors. And they looked at everything. They looked at their labs. They looked at their disease, when the disease started, when it ended, when it led to death, and when it led to recovery. They looked at the medications they gave them. They looked at the outcomes and the time. And so it's an interesting study, and you can find it online. I found it, I guess, Crossmark. But it's the clinical course and risk factors for mortality of adult inpatients with COVID-19 in Wuhan, China, a retrospective cohort study. So, and again, I'm not a research expert. I'm, just a dietitian. But I do see some interesting things about what they found, and particularly with it seems like, okay, so there were 29 people with anemia, and 26% of them did not survive. Anemia is when you have a low hemoglobin. You don't have enough iron in your blood, or you've got a problem with your blood where you can't carry oxygen. And it's all about oxygen and breathing with this disease. Albumin. We'll go back to albumin. I'm not going to get into these labs really that much because there's a lot of them are. Okay, so I was looking for something that all right. The age in years was 56. The average age was 56, and it ranged from 46 to 67. The people that were non-survivors were from 63 to 76, and the survivors were, of course, a little younger, from 45 to 58. The average, I guess it was the average age in years. 69 was the average age for the non-survivor, and 52 was the average age for the survivor. And I'm actually going to be 50 this year. Of course, we knew that males were more at risk because 119 males in the total and 38 were non-survivors. That's 70% of the non-survivors were male, and 59% of the survivors were male. So there was a higher percentage of the non-survivors that were male. There was 30% of the non-survivors were or people who died were female. So it's like 70-30, okay? But when it comes to surviving it, if you're a survivor or you get to live, then it's actually more even. There's actually 41% female survivors and 41% of the females survived and 59% of the males survived. Okay, smoking seemed to be a factor. There were 11 people out of that group who smoked, and 5 of the people died and 6 survived. So there was about 9% of the folks that they looked at had died because of the smoking. We knew that already. The biggest comorbidity, of course, we know comorbidity means It means having a pre-existing condition. So things like they looked at hypertension, they looked at diabetes, they looked at coronary heart disease, they looked at COPD, carcinoma, chronic kidney disease, and other. For the highest comorbidity for the disease, the one condition that had the highest amount of deaths was hypertension. Hypertension seemed to be the highest at 48%. Out of 58 people, 48% died because they had hypertension, whereas only 23% with hypertension survived out of that group. So there were 58 people out of the 191 who had hypertension, and out of those 58 people, 26 of those died that had hypertension. 32 survived. Diabetes, 36 people, 19% of the group had diabetes. Out of those people that had diabetes, 17 of those people died. So that's a 31% chance. 31% of those people that had diabetes died. 48% of those people who had hypertension died. So 48% of the 58 people who had hypertension passed away, and diabetes. Coronary heart disease, of course, as you can expect, 24% of them. There were 15 people with coronary heart disease and of the total study, and there were 13 people of those that died. So they only had a 2%, or 1%. Only two people out of that 191 survived. COPD, there were only 6 people with COPD, and 4 of those out of the 6 died. So the only 2 survived. So it seems like if you've got a pre-existing heart condition, COPD, hypertension, diabetes too, is pretty high chance of passing away. Carcinoma, they only had 2 people in that study. Chronic kidney disease, they only had 2 people, but those 2 people passed away. And again, that's hard to say with small numbers like that. Respiratory rate of greater than 24 breaths per minute. There were 56 people who had a respiratory rate of greater than 24 breaths per minute, and 34 of those 56 passed away. So that's interesting, because greater than 24 breaths a minute, that means you're trying to catch your breath. That means you are, short of breath. You're trying to catch your breath. You're probably breathing more oxygen. Maybe you're panicking. That's when the virus has gotten pretty advanced and you're losing a lot of your lung function. Pulse greater than or equal to 125 beats per minute. 2 people had that and 2 people died. Systolic blood pressure less than 90 millimeters per Hg. So low blood pressure, hypotension is what they call it. Fever. 180 people had a fever that was greater than 37.3 Celsius. Not centimeters, Celsius. That's a lot of data. Maybe I'll go over this on another video. Okay, so getting back to fever, greater than 37.3 Celsius. I'm terrible with this stuff. So 180 people had a fever. And out of those 180, 51 died. That was 94%. I don't know where they get that 94% from. But 94% of the people that passed away, 94% of the people that passed away a fever, but also 94% of the survivors had a fever. So fever doesn't seem to be like an issue as far as, whether you survive or not. Out of the 151 who had a cough, there was 79% of the group had a cough. So 94% of all the group who had tested positive for COVID and were hospitalized had a fever. And it was kind of equal between the survivors and the non-survivors. They were all 94%, so that's interesting. But some people don't have a fever. And then cough, 151 people had a cough. So that was like 79% of the group. And 39 of those did not survive. That was 72%, and survivor was 112 of those folks who survived had a cough. So it was kind of even. The non-survivor, the person who died from COVID, there was a small percentage who did not have a cough, which I thought was funny. It was kind of interesting because I did not have a cough. Now, I have every reason to have a cough because I'm not exactly the healthiest person myself. I try, my vitamins, but I could be a lot healthier. But I'm surprised that I didn't get a cough. But I didn't get a cough before I got that shortness of breath. And there's a lot of people out there like me like that. Sputum, you had something that you were spitting up, coughing up, There were 44 people who had that. 30 of those 44 survived. And only 14 of 14 people of the did not survive. So that's interesting. Maybe if you coughed up something, if you had that dry cough, it kind of stays down in your lungs. Myalgia, fatigue. There's interesting. 44 of those folks had fatigue. I had fatigue. 15 of those 44 did not survive. That's 28% of the population that had fatigue did not survive. And then 21% survived.